Last night, we shared the Health Department's warnings about a spike in malaria cases in Gauteng and Mpumalanga, parts of the KwaZulu-Natal and Limpopo. Tonight, we share more on the work being done to stop malaria and to ensure that people know enough about it to prevent or to act as soon as they have symptoms of infection. Sherwin Charles is the CEO and co-founder of Goodbye Malaria and joins us now. Sherwin, good evening to you and welcome to the program. Your goal is to spread the gospel about malaria and the risks and interventions that encompass it. Share a continental perspective on how deadly this preventable disease is.
Thank you very much for having me on the show. Absolutely. When we look at it in the context of Africa, 85% of the cases of malaria occur in sub-Saharan Africa, and more than 90% of the deaths occur in sub-Saharan Africa, of which 80% are children under the age of 5. We've had around 600,000 deaths from malaria the past year.
Wow, that's such a grim picture, and it's really something to think about, Sherwin, when you share that 80% of those deaths are related to children. So last night when we were speaking to the Health Department, we understood, of course, this is preventable and it is curable. Given that this is the case, why is the prevalence of morbidity why is morbidity so high?
I think there's a number of challenges. First and foremost is malaria is the disease of the poor. So trying to get access to healthcare is a huge challenge. A lot of the cases occur in rural areas, in areas that are affected by climate change, by storms, have lots of standing water. And so I think that the challenge that we face on the continent is that we have health systems that are not strong enough. We tend to have a lack of resources. Most of the funding for malaria comes from global donors, such as the Global Fund and the President's Malaria Initiative, which is part of USAID. And so we're reliant on commodities and implementation of programs with outside funding. Of course, this comes with a lot of conditions, a lot of reporting, and poses a big challenge to our departments of health.
So the Southern African Development Community, SADC, commemorated Malaria Day 2 days ago. So what is the main message of both the gathering and the campaign that you run in Goodbye Malaria?
I really think that the message is our progress and the amazing progress that we've made since the early 2000s has stalled. It has been negatively impacted by COVID, where programs were not able to continue, and that resources earmarked for malaria were actually channeled to fight the pandemic. So the message is really to continue to innovate, to bring new products to market. We saw how quickly a vaccine for COVID was made available, yet for malaria, we've struggled all the years. There is some good news on the horizon that a new vaccine will be in place soon. I think the message is to our communities is to stay resilient, to ensure that you don't become despondent, seeing that the cases of malaria are going up, really to take preventative measures, that, malaria is a disease that can be prevented. And then to seek treatment if the symptoms are shown, particularly if you have a fever, ensure that you get a malaria test done. These are messages that we need to constantly be reminded of, and we need to have in place across the whole sub-Saharan Africa.
Yeah. When we chatted to the Health Department yesterday, one of the messages that we reiterated was you can't have a laissez-faire attitude. If you're traveling to malaria-prone countries, get the prophylactics, get the drugs that you need ahead of time, make sure that you are protected. As you've just shared with us, when you come back or wherever you are, if you start to have these symptoms, go and get assistance, get a test. So I'd like for you to just reiterate what those symptoms are and what the testing encompasses, so that if someone, who might have traveled or might have contracted or been bitten here in South Africa knows what to do.
The symptoms are very similar to that of the flu. It really portrays itself in a high temperature, in nausea, in blocked nasal passages, in diarrhea, in shivers. So just be aware that if you have flu-like symptoms and you've traveled to a high-risk or endemic area, please ensure that one of the tests that is conducted is a malaria test. It's easy, it's done through a rapid diagnostic test, and the result is available within minutes.
And really have got to take it seriously. So just to close, Sherwin, your organization and people like yourselves in the business of building public and private partnerships, including high-risk countries, to ensure that no more people die. Just walk us through some of the activism and for other people to get involved with the work that you do.
Absolutely. I think we've been very successful in a public-private partnership. We work together with the Departments of Health in South Africa, Eswatini and Mozambique. Our programs have really been run with a private sector mindset. We've ensured that what needs to happen happens, and we've been very diligent and resilient in the work that we do. As such, Goodbye Malaria had protected more than 4.3 million people in sub-Saharan or in Southern Africa. I think what's important is partnerships. We've just launched a partnership with Discovery and Vitality, where funding from these organizations through the incentives that they give to people getting rewards for good behavior, good health habits, will be matched by both the Vitality system as well as the Nando system. So we're asking people please to visit our website, www.goodbyemalaria.com, and see the work that we do. As well as if you're a Discovery member, please support us.
Thanks. So I've just been given a little bit more time, and I want to ask you something important. When we think about the ecosystem of these mosquitoes and how they thrive and how they proliferate, why are we not able to deal with the root cause in managing those mosquito populations? I know you said that in rural areas, you know, you've had where there might be rain and stagnant and pooling water. Just talk to us a little bit more about the ecosystem of existence of these mosquitoes.
These mosquitoes are incredibly strong little buggers. They seem to survive under any condition. Where our challenge has really come is twofold. One, the mosquitoes are building insecticide resistance. So the insecticides that we have used effectively against them is becoming less and less effective as the mosquito mutates and becomes stronger against it. So we need to get new insecticides. We need to have a rotation policy so that we can win the war against the mosquitoes. The second challenge, and quite a big one, is climate change. One of the outcomes from climate change is that we're seeing increasing mosquito populations. We're seeing high altitude areas suddenly experience malaria, where in the past the mosquitoes could not survive in those regions. Global warming is ensuring that the mosquitoes breed quicker. What we've also seen from the cyclones and the hurricanes and the storms that we have is new species of mosquitoes are starting to come onto the continent from places like the Middle East. We have a new species that's been identified that is a more efficient transmitter of malaria. Wow. So these are worrying signs and great risks that we could face in the future.
Well, Sherwin, thank you very much for sharing what is a very important public service announcement. And given that 80% of those deaths that you mentioned are in the child population, it means that caregivers and parents and the community needs to pay really close attention to where they're playing, where the sites of vulnerability are in terms of being bitten, but also, you know, the preventative measures, the mosquito nets and you know, the various roll-ons and things and sprays that you can spray to protect yourself against being bitten. And also, once you see those symptoms, the high fever, the nausea, the blocked nose, the diarrhea and so on, go and get tested. Sherwin Charles, thank you. Appreciate your time. He's the CEO and co-founder of Goodbye Malaria.